Hi folks, my name is Djuro Petkovic and I am a shoulder, elbow, and sports specialist from the Illinois Bone and Joint Institute. And today we're going to talk about the difference between tennis elbow and golfer's elbow. These are both degenerative conditions of the elbow, meaning they develop over time from wear and tear. And there's some confusion about the difference between the two, so we'll try to sort out those differences today. Tennis elbow, also called lateral epicondylitis, is a condition involving the outside or lateral portion of the elbow. It does not necessarily result from playing tennis. In fact, most patients have never played tennis. It's often seen in people who do a lot of manual repetitive activities, and it is called lateral epicondylitis because it is a painful condition involving the lateral epicondyle, which is where the tendons that extend your hand and wrist originate. It can be aggravated with heavy gripping activities or when you try to lift something heavy with the palm facing the ground. You can actually check this condition on yourself. Take your fingers and wrists and extend your fingers like this. Now take your other hand and try to push those fingers the other way. If you develop symptoms that recreate that pain on the outside of the elbow, this may be a sign of tennis elbow. Golfer's elbow is similar but on the inner part of the elbow, and the official name for this is medial epicondylitis because it affects the medial epicondyle, the sharp point of the elbow where your wrist and finger flexors originate. It also occurs in people that do a lot of manual work, and again, you do not need to play golf to develop this. The treatment for both of these conditions is similar. You could start with anti-inflammatories like ibuprofen or naproxen, and I usually recommend a consistent course of these medications for 2 to 4 weeks. There's an endless number of braces out there, though I personally prefer the strap type of braces that tighten just below the elbow. Home exercises can also be helpful, including stretching, and there are several online resources for exercises while we are social distancing. Formal occupational or physical therapy can often be helpful, as can injections that are done in a simple office procedure. Finally, if months of non-operative treatment are ineffective, surgery can be considered where we actually cut out the diseased portion of the tissue. If you think that you either have golfer's or tennis elbow and home treatments have not worked for you, make an appointment with your orthopedic surgeon. We could go over options to help you along. Thanks for listening, and please stay in touch with us at Illinois Bone and Joint for any further advice where we hope to help you move better, live better, and most importantly, stay safe.